Sir?
Yes, because you are surrounded by a lot of francophone countries, Benin, Togo,
Burkina,
Cote d'Ivoire, Burkina. It's also so you can communicate with them effectively.
I see.
Know? Yeah.
D'accord.
Yeah, we d'accord. Oui, c'est vrai.
Anyway, welcome.
Oh, thank you. Thank you.
You see a twan come on now last week.
Yes.
Come on
Yes,
film
true,
and then your friend why you perceive some myths surrounding breast cancer. It be a cancer. Hey, it be boy who pa no me dey ni after okoye no. They say
I'm out for friend.
It be said na man for kunu no ma de na obenya ne ntem. I said they be ya no tuemu sa. E bi so say so no for na kese a wonya ne ntem nti omo no for so no omusuro.
Oh no.
E bi just in some man comfort
can.
Intimate and de to bo ase na fa to form boko. Some of the myths no demystify them for us.
I'll do so mesa.
Ti akwaba.
Me das yeah. Good. And I'm sure be so try no pay. Like you said, no myths no endorse, but false information and the truth and no crying no. Into na be digest be break it down fact no.
Very good.
Na the kind no now kind no about say mema no almost about train for na ema na nya breast cancer.
Said ya owo a oma emofra no enomo che no. Ema onya. Na afi so mema no so emofra no twa no fo no wi say mema no so to aso.
Okay.
No mo say na be ya unya doc na asema make serious na osiri.
Because I message on my screen no. False information. It's the no cray.
Okay.
Also, breast cancer no, they're designed for breastfeeding and for collier for babies. Breast no man design a man say member no for no. What you say? Just that because it causes pleasure. It's an the main job of the breast is to breastfeed a baby. So man a collar no for you. What I say? The main function of the breast. And the reason why breastfeeding is protective and preventing breast cancer, they say breast milk production during that time no hormones. If the estrogen and progesterone drop it during the breast milk production and those hormones breast cancer cells they feed on them. So when there's a drop and that's we need feed on, and that is why we advocate say women should breastfeed their babies. But a man sucking the breast, that does nothing to the affecting breast cancer in any way. It's just for pleasurable. Yes, they're not sucking milk. Milk is not being produced.
Yes.
What I say? It's just pleasing the woman. Some the post were very one of the erogenous zones. Say what is in there, but and it doesn't have any health way impact in any
benefit be any no for na me ma ya fa no World Cup.
Ma fa na World Cup dey man na ma fa ma dey World Cup.
Sir.
Oh, man, I'm off my day World Cup.
Anyway,
it's a steady.
Obo bi ne Dave. Said Dr. Mark account. You see Dr. Raja, Dr. Mark baby obi abi che no pay. Dr. Raja say enye no for na ye nom no enkusi hwe bi a wow pleasure na pay a fine. But breast cancer there, onum oba no o be ma pain toto onum no for na enye ne hwe. One method what demystify and okay just a no correct okay and but omo breastfeeding channel they have lower chances.
Yes, they have lower chances
of getting breast
cancer. Yes,
as I say omo abofra no enum
breastfeeding kola no more
na papa no beto aso a o twa so ama no
and one no okay breasts are for babies not for men.
Okay na mate say man so omo no fo esoso no omo tanya breast cancer
it's not too false information. What size of your breast does it affect whether you get breast cancer or not? For instance, it's like men matching breast cancer no because you don't say what's a men mono for so baby like the way my or breast they're still able to get breast cancer. Once you have a significant amount of breast tissue better man your breast cancer. It's the size of the breast that doesn't matter in any way.
It doesn't matter.
Say so, say balloon say from here to here copim no, it doesn't really affect. We've seen more small breasts that better breast cancer. What I say, it's a no day, it doesn't affect it in any way. And then the fact that people also think that a man can breast cancer, no, a man what's the last week I make say, man breast cancer. And I think I even shared the picture with your producer because they already display a bit later.
Yeah, producer, I'm so that picture now. A man
yes,
a breast cancer, be maybe a trap,
no for
and I pump.
Into what say, or why a double mastectomy? Into both sides of the breast have been taken away. It's what my whole scars on his chest. What you say? So it's not only women who get breast cancer, it's also a myth. Men can get breast cancer too. Yes, that's more common in women. Women are 1 in 8 women, but then the men is 1 in 100. Into the men have a lower chance, but they can still have it. Yes. And there's another myth that says that women that wear tight bras or they put money in their bra, they put their phone.
Yes. So the CD no. Breast cancer
and all that. Those are also myths. Okay. The only thing that you can get are probably infections because money is dirty, so you may have some. Sikayefi. Inti un person would share will know for no man baby. Because bet man infection a free more. But and just say because say breast cancer no per se. What you say? Hey, mobile phone radiation of way from phone and so much say bet man cause breast cancer.
Hey, it's me the phone na share me no for every time be na breast cancer.
We not breast cancer. Just that a healthy thing in terms of like infections and man, no, because man other problems from it, but it lead to breast cancer per se.
So more the phone I stand no. I say any stand or the shame no the casa. Holding it.
But I mean, it's not the best thing to do, mom. But I'm not saying say like or say yes, like for phone question there be. But what I'm saying that in terms of breast cancer, no, doesn't cause breast cancer.
And a man so omunta mbo breast ya no. Omunta breast cancer and also
and also no it's not research in tray and show say like ebia we be a wunta mbo bra u benya breast cancer na wonya breast cancer no yen linking it to breast cancer in any way. So be share bra so won share bra. That's your own cup of tea. Just that ideally, you want your breast to be free most of the time. And just say they be now package you could that share breast. I mean sometimes let the breast be free, like yes. But it doesn't mean say and the reason why we even advocate for that is that what's the coffee baby? Almost share breast about 2-3 weeks share the same bra.
Without washing.
Yeah. So that's more of I think about more of infection control, like so what's my application infection from that.
No for senior
sweat. Things get trapped in the bra and all that. And so I focus on that, but and cause breast cancer per se. Just that I mean to be healthy and all that. So you do want to advise them say they be have a bra on. Let the bra be free sometimes. And some inflammatory.
Already 50-60 years and above, almost high chance of getting breast cancer. And also,
okay, and you say a very good question. I know say myth, and I make us intro false information. Initially, no, now you're home paying for someone with breast cancer. But I say I know never say lifestyle changes be bra bomo. So say my be bomo nya mo pure than tem. Ebedum so mo nya mo menopause late. Others too are smoking a lot than they should. They are leading very bad lifestyle. Very bad lifestyle. The DA, they start their money. It's a lifestyle habits now. It's my age of breast cancer na bathroom. It's not about 25-year-old cry being diagnosed with breast cancer. Even a 22-year-old being diagnosed with breast cancer. Things have changed, and then the way I see it's a find age no juma like before. Now first who take breast cancer and can who drain and penny for no. Maybe I will be 45-50 no when you breast cancer. But say no, young cancer na young no. Na enya sa yare no. Into say age no, I should anya factor bio. Breast cancer management.
I see.
Into vicinity both young and old. It's men can say where they penny for yare me young. Me do sa age me it can
happen. Many times I say go for a mammogram or a scan when you are 40 years and above. It creates the impression that if you are below 40, you are safe.
You are safe, yes.
Yeah.
The reason why I can mammogram, they say, what's a mammogram? No, never yet me who with the insano. It's me who with the mammogram. Because I do it like an X-ray vision. It's me picking the abnormal findings or any changes in the breast in them.
But why do they limit it to 40?
Yes, because of the density of the breast during that time. It's less dense after 40. The mammogram, is quite helpful. But then you can still do the ultrasound scan if you're under 40. As now, if you're in your 30s, you can still go and do a scan. After doing your breast examination, you can go on and do a scan. The scanner can also pick any abnormal findings. If you have a lot of money, you can even go ahead and do an MRI. Because MRI is like the yes, like the golden standard. Just that it's quite expensive, so we don't opt for that. We've seen such abnormalities that we will say go and do MRI. You know, but for screening purposes, the scans and the mammograms are okay based on your age limit, and then the breast examination that you do as well.
You see, Abba sometimes no, a money be no so Abba it to be a better or monofomo. Na Matisse be say, and yet Abba in I down no for mono and a breast cancer.
Okay.
And also,
yes, and also a very good point. Why raise it? I'm all for you say, Umuhu Abapa, hey, me baby, when I'm in a cancer. At least about 50 or 60% of your lamps are non-cancerous. They're benign or before. Every lamp be a cancer. You don't assume say so fully be cancer, but just to be sure, no. Also buy your home. I further checks actually. If I be biopsy, best my fat tissue nika kana show microscope ma say okay, ampa where cancer, when you cancer. Best make say okay, koye mammogram, koye ultrasound scan, koye MRI, and I be na who exactly what's going on. It's we or ba now feeling lampa. Don't always be in a hurry to get scared, and I don't think of the worst. Better so be quiet. Sabi ho na almost check it, na confirm say yes. We are bump and kasa, and it's more likely to be like this. More likely to be like this. Na yen mu intro.
You see a udware we are your name be a defy motuum. They to me dry. It be a deodorant. Me say I am a deodorant. Me pediatron antiperspirant. Because Mate said no nema a dry in tem and kekaka or underwear in soon. And so the editing say ye boy who say no so no you soon be brea antiperspirant in a woman who you seen be brains what utuminya a bit breast cancer as Obama and as Oba.
Okay.
And no way.
It's a not a myth. Okay. It's a no cray, not a false information. It's the antiperspirant when you link it to breast cancer in any way. It's about to go ahead. I used to antiperspirant, no. Once because the because say motum no breast issue to me around no. And even when I do an examination, also will check it on so count because it also extends into the axilla. Breast tissue not extend into axilla no. Into I can armpit. Breast tissue extending to yeah, yourself. The technical ones the back I can now say
very tom.
Jagos no. Jagos the door so it's a breast tissue a bit to me ra armpit motum no. But it doesn't mean say who you say antiperspirant and I be able cause breast cancer there. It's better to go ahead. I use antiperspirant, you know. Safe.
Hey, and then some way at it some.
Oh, mate, the doors be brave.
Oh, family history of cancer, that breast cancer, does it always guarantee say definitely you get it?
Okay, and not always a guarantee. Just a higher chance, like we are more likely so many. Okay. More than the average person now, or no be. It's about 2 to 3 times likely to have breast cancer. But people also, strangely enough, they have it in their family and they never get it in their life.
Okay.
Others too don't even have one family member and they end up getting it. It is science today. We always say the science and not absolute or a bit of some gray areas in between. It's one the pepper say by all means my family, maybe my mommy will be me auntie will be so I also get it. It's not always like that. It's a sign.
Okay. Ebusia, yes, the paper in just a few minutes. You who say and somebody be brave at it no say no cre. Until no for swan, no just obenya a breast cancer. And now one more brow, and no interest obenya breast cancer. Oh, ababe tom now we mushisio. Until I see a lot of fear, confusion. It's a man for slow crass on Beko check it. If you say as my attack and say the fear of the unknown, better. Because when you hope you say me who say I know hope na must start jojo. It is enemy ko check cra ma me hu. But doc actually no pay. Or say say na mani nyina enye no kre. But go early. And now mo can say
early detection is key. Yeah, early
detection very key. Into abbreviation how many times as oba and say me twiben ayarasabia na me check him no for.
Okay, it's we low risk person that's once a year. once every 3 years, sorry. Until which are any very high risk of getting breast cancer. If be a doctor says so, walk a whole ones, then I can say, oh baby, come every 2 to 3 years because when you're a high risk person. But when you're a high risk person, then I was so call every year. And so we drew at least age 45 going now. Was all call every year. I have to do at least the mammograms as well every year.
Wow. Na ahwe yie ben na metumi aye. Say anano me beside but mantia say me wo particular edrubi say me nom na me de be prevent ahead of time. And me wo particular exercise be say me ye na me de prevent breast cancer na.
Okay. Into breast cancer no because I actually need specific cause. Obviously, say like malaria to some cows so malaria no. Into a lot of things that are you need particular cause. It's to me can say okay, don't do this or don't do that. Just that we made a few speculations and assumptions. Science address okay, more lead a healthier lifestyle no. They are less likely to have it, you know. Into like they're not smoking. We will screen and know from time to time because screen and know the member who say you have it or not. So I check every month by yourself. I won't who say if you baby wo because if you know your breast so well, we every month baby pack like just within where you say this month is different. Yes, it be a crib that high wasn't here. And my nipples no this time I looking flat and back out and then they so what I say. And this is the time where the husband starts with vigilance. Like my wife in chain, so wife no be the breast no bako. I feel so crossing the other one. Oh now I'm alert.
Tina was my so me. Man so made them who said
that is the reason I when the men suck it, it's prevent maybe because they can detect something early.
The men can help with the examination.
Yeah.
The men can help. Go to the time, husband people no who say, oh, what's a man? Should I share no for no? That's how I saw it. We forget that we have breast sometimes. Me also, even put on my brother. I remember that I have my breast there. And just like what drink, because it's a part of you. Until who should I and drink? Say, okay, me no for harm. I mean, yes, say. But what's a man? Because that is what they are excited about. No, they tend to focus a lot on. They pay attention to the breast. Into a lot of the patients, on my back, I say, oh, my husband, he saw that my breasts were like this, and he drew my attention to it, and You see, I'm focused on husband too, not like
I get it.
Not boyfriend, girlfriend.
Dr. Raja, oh, you go for warrior.
Not the Salome boy.
You just said our warrior.
Which one is the Salome? Which one is the Salome?
When the man goes and sleep in the woman's house, have you heard that one?
Yeah.
And then the washer is the other way around.
Okay.
Yes. So we're talking about those ones. We're talking about like genuine husband and wife marriage, where you're sleeping with the woman every night. So you can pick up those things. Open the best carriage or ban and say, oh, I never check him. I mean, check him out. But that you should know how to do it, though. The men should learn so they can also help their wives.
Let's take cancer itself. When you find out you have cancer, is it given that you are going to die?
Not necessarily. It depends on the stage. So if we identify it early, the stage 1, stage 2, I know that clearly we can just do the surgery, take it out for you. You can do the chemotherapy, radiotherapy, you'll be fine. Then that should be okay. And another challenge is if the woman accepts her diagnosis. Some women, they'll tell her, oh, doctor, me need breast cancer. They'll be about it. Let me go and speak. So that also delays the management. Some will go to prayer camps for like 6 months. When they come, the whole breast is rotten. Some will go and do herbal medicine. They will come and they'll have scars. They'll go and cut them that they are bringing the cancer out and all that. And once I know, and also say treatment,
Yeah.
So, Barney to me accept it. Say, okay, indeed, I have the breast cancer. You are willing to accept the treatment of the breast cancer. That's what the doctor has spoken to you. Say, okay, I was saying, say, I was saying, trial no for, I was saying ABC. Now, what I can say, okay, I'm going to accept this my diagnosis. That's okay. It makes the treatment easier for us because the woman is going to comply with everything you say. But my no one say, I'm who way clinical psychologist to at least have her mind, prepare her mind and all that. Oh, you don't want to go and come back and then somebody even goes to the other breast and it's bad. It's like it's in a terrible stage. We've seen women who have like it was just a one lump. Now they go and come back. The whole breast has ulcers and sores around it. Yeah, and now there's bloody nipple discharge coming out. It's an eyesore. In men, women do say diagnose why. Men panic. Oh, breast cancer. No, you have to be a fighter. I was a woman near them. Especially who are first early stages that you know we can treat it. Why not? Let them treat it for you. It's different if you come very, very late. Very late. Like be at stage 4. No, I spread that could be beer. You can't do much about it. It's going to the lungs, the brain, the spine. Metastatic breast cancer is hard to treat. But the early stages, the over, and we just saw that okay, this is the way you should do. Please, we beg you, please follow through. Men can say, you can pray alongside, but don't abandon the treatment. So, prayer can be 6 months to treat breast cancer. Breast cancer is not treated at a prayer camp.
Okay. And I think that's where we have to hammer on, because if a doctor diagnoses that you have it and they are giving you advice or a treatment, and you think if I go here rather, which is not a health facility, I will get treatment, then I think we need to prepare people's mind for that.
And bibia near the transfer them no. And then many be or Odin Paibo account. But ubetu one more acquire sabia. A doctor for no unyankopon e mama ye. Omoya yare safo.
That's true.
Ombe sene be ya wapomuden no ebe content tem ayare sa ne be content tem nti aya na ye say ode be kwa akodan ayare sabia esen said ya obeda so ready ma bompa ya conchisa doctor so ebi bebre no ombe ba na no for na apro prophet no be ni dio but ese won so utu na mo nti samre me person ka producers ne be allow be 1 2 or 3 calls bi obi o hwe na adwan ne kisina bi ontiase we hu science bi ni ade doctor will have for some few minutes at least now on to be 2 year for nti bia o hwen what to say ye bohu de ro asembi se bi adwuma yo basa bi ase wonti bi ase ye we hu bibi e wo no fo ho unima de kro doctor wa ha nti obetumi afre 0558 462088 na we bisa semfo man ba ko mienu bi enwe so betumi ayi anu amaye breast cancer ho de run ye ebo no minua ba ese men twen e ma na ye too late o twen na ye too late a obedu no ebia na ye ntumi anso anu asemba ko kan so ne say cancer no e affect o no fo na enye say hope o it me affect o adwen o spine o baby o lungs o baby e betumi affect it. Good morning, Rejoice. O frefia so fan. Hello, good morning, Rejoice.
Hello.
Good morning.
Hello.
Hello, good morning, Rejoice. It is saying.
Good morning, Dr. Frank.
Now, what is saying, Opay?
Pacho, good morning.
Good morning, oh. Doctor, who was saying, Bisebi Mana, breast cancer?
Pacho, person may be some doctor. I will not need to work. I will perform when you enter school.
Omotu yomu show.
Pacho.
Eta ba anase ababa ko mienu bepe.
Ba ko be be e ma me style e tinu ya paint no.
O ti paint no onu for hon na omotu yomu hihye o.
From family ya me ya.
Okay.
Na enu system.
Okay. Nti yate obetumi the phone now to doctor ebe ma ho mwae. Why? Ma o TV no ha na ti advice or the be ma o. Also betumi afre 0558 462088. Doc.
Yeah, some people say be on their hospital pay, and I said she just, but I think she's gone off the line.
Yeah.
I want to understand. Also, no for any year
plus. For any year.
Yes. So I don't know the age though, but my advice is on-call hospital.
On-call hospital.
Yes. Okay. Yeah, examine the no for any man.
Okay.
Including the armpit region as well.
Okay.
Now, either said, depending on the age, we can either do a mammogram or a scan for her.
Okay.
To know exactly what is going on.
All right. Good morning, Lois. Also, Frefia Dental. Lois, good morning.
Pacho, good morning.
Okay, Dr. Waha, was Mr. Bimana?
Pacho, so, about some 2 years ago, no, when you say I'm some discharge, my breast.
Okay.
So I've been to the hospital, I've done mammogram and everything. So the last year, the doctor said I should go and do some checkups again. And then when he said, there's nothing wrong with me. But people were like, it's hormonal imbalance. And he told me that it's not hormonal imbalance, but it's a normal discharge that comes from my breast.
Okay. Please, which hospital did you go to? Or you don't want to mention?
She's gone off.
She's gone off. Okay.
Yeah.
So I always advise that they should go to the bigger hospitals. You know, we have a big breast cancer unit at Kolebu. And we also have a breast cancer unit at 37 and Ridge. When you go to the bigger ones, it's better. If she's in Kumasi, you go for another teaching hospital. Yeah. The reason being that there are more specialists there than the regular ones, you know, and they are more advanced in their training.
Yeah.
When it comes to breast care issues or anything related to breast and then breast cancer. We have breast specialists over there. They are surgeons, yes, but they handle breasts, yes. So my advice to her is that she should seek another. I always say that when you get an opinion from one doctor and not so sure, always go to another doctor and then try and see a different hospital at home and just try and see. Okay. Because you might get somebody who has more experience than the one that you saw. Okay. It could be that maybe she just saw a general practitioner who doesn't really have a lot of expertise on that topic. So
okay. Good morning, Regina. How free of uncle?
Good morning.
Good morning, Doctor. How bit maybe sano?
Pacho maybe can say. Na me kwano etai mi ya but sem chepia wo mu nyame.
Okay. But no for no, that's the nipples, no. And no.
Anon.
Okay. Pacho, how many years?
Pacho mo 39.
39. But what kwa mama show no for pain?
Pacho de.
It's mama should take advantage why this pink October no. Maybe I would say no, and also of Fanco. I'm sure there's a lot of should be a community hospital or polyclinic nearby. Yes. Also, a work clinic be a benwo. But come check him out as soon as possible. Why?
Right. Thank you. Yeah, that's the same one I'm afraid. I'm bringing kakra. Doc, problem with Hopa.
Yes, I guess that people really have questions.
Yes.
I think we have to have an open session for everybody.
Yes. In questions,
no problem. And they can always just send me. You can find me on social media. Me and Dr. Rob, baby. Just look for me.
Facebook, Instagram, and everywhere.
Everywhere. Just send me message. I'm respond there,
but any general number be I know
me number there. Hey, me that I didn't sleep that day. Yes. That's me from my number name but I just say come and look for me on social media. And I'm very good at responding. If you're not even following me, put me who say why I request.
Or you're very active. Or you're very active on social media. You know. Yeah. Into you better pass and Dr. Rajwa, a public health specialist at War 37 Military Hospital, Department of Public Health. Now, they be October no. You need the agra and one day. No 4 day or who experience pa international no. Social media on Sabeka hope a personal advice via obit media amount. And I say said your kind of problem no wa ben hospital be a ben especially polyclinics no. And Pink October omo ye free screening. Nti bora ho na ko check e free. Men twen. Why? Bora ho na ko check. You be try on kakra ba ye ba me Kwame yogurt and ebe num yogurt wa ebe num yogurt you ba sisi a